Now let's discuss the cancer and ozone and the effects of ozone on cancer. Okay, what is the root cause of cancer? The root cause of cancer is founded by a doctor by the name of Dr. Otto Warburg in the 1900s. And he found that all forms of cancer have two basic conditions. That is, you're acidic, you don't have oxygen. That means you're hypoxic, you lack oxygen, and you are acidic. And he got a Nobel Prize in 1931 for that. And nothing has changed since then, since that period of time. Today we've made many circles around cancer therapy, but we still come back to the same thing. It is lack of oxygen and an acidic body. If you've got lack of oxygen and an acidic body, that is the body that's going to get cancer. So deprive a cell of 35% of its oxygen for 48 hours, it becomes cancerous. Deprive a cell 35% of oxygen for 48 hours, it becomes cancerous. His research revealed cancer cannot survive in this environment. So what role has that got for us? That's where ozone comes in. That's where ozone comes in the treatment of cancer. Ozone is the natural alternative treatment for cancer. It does not damage the body like chemotherapy does. It kills cancer. The root cause of cancer, just as a little bit of scientific background to the work of what Dr. Otto did, the one on the left-hand side is a normal healthy cell. A normal healthy cell requires oxygen to come in, and it needs the glucose to come in together. When it comes together, it goes into the powerhouse of the cell, which is your mitochondria. The mitochondria, the powerhouse of the cell, takes the oxygen and takes the glucose and converts it into energy, because that's what's required. And it produces what we call ATP. So in a healthy cell, you would get oxygen coming in and the glucose, and you produce 36 ATP in a healthy cell. Now, expose that healthy cell to toxins from whichever form. We are bombarded with toxins, from infections to heavy metals, to pesticides, to herbicides, to parasites, to all the different forms of toxins that are entering our body systems, from the air, from the environment, through our food, that's entering our systems. That toxins causes damage to the cell wall. And what happens in that case is that the cell wall has a channel in a healthy cell which allows the oxygen and the glucose to enter in. So when that channel is damaged by those toxins, then you get a flooding of the glucose coming in. So there's a lot of glucose coming in, and the oxygen is deprived because you've got an oxygen-deprived environment. So if you've got an oxygen-deprived environment, you've got a lot of glucose coming in. Then that powerhouse of that cell, the mitochondria, cannot produce 36 ATP. It goes down to 2 ATP. That means it cannot produce energy. So what is the root cause? It is lack of oxygen. Lack of oxygen. So to reverse the process, how do you reverse this process? Reverse the process is look at the root cause. The root cause is take the toxins out. And how would you do that? Do a detoxification program. Decrease the glucose. Take out refined sugars out of the diet. And increase the oxygen. That's the treatment of cancer. The root cause. Decrease the toxin exposure. Detoxify the body. Decrease the glucose. Go on a ketogenic diet. Increase the oxygen. That's where ozone is. Flood the body with ozone. Flood the body with ozone in whichever format is available and whichever way it's available. So that's how you would address the causes of cancer. Now you stress the cancer cells. How do you stress this cancer cell so it breaks down? Is that you create a state of hypothermia. That means you increase the temperature in that cell. And once you increase the temperature in the cell, then the toxins will move out of that cell, and then you would have a reversal. The second thing is you subject that cell to PEMF, that is your pulse electromagnetic frequency therapy, and that will stabilize the cell membrane. Once it stabilizes the cell membrane, then those channels will not allow the glucose to move in freely. And the third thing we could do is use some herbs to stress that cell. The first thing is to expose that cell to ozone. Expose that cell to oxygen, and that will kill the cells. That will kill those cancer cells. So how do you address the causes of the cancer? Hypothermia, PEMF, ozone, amongst other things. We are mentioning these things so that we can see it in the context of oxygen ozone. Which therapy can deliver all the above?
Okay.
Trick question. Hocatt. You've got hypothermia, heat in the Hocatt. You've got PEMF. You've got oxygen ozone coming in. So you're treating the root cause of cancer already. Hocatt and Cancer. Let's see, out of those 10, power of 10, what is the Hocatt delivering in the context of cancer? You got your ozone, which is going to kill cancer cells. You got your PEMF. You got electrotherapy. You got the right frequencies. You got 133 programs, and some of those programs are specific for cancer, for different cancers, can be specifically dialed in for boosting the immune system. Then you've got the whole body hypothermia which is occurring, that you got your heat going on, and then you've got aromatherapy. Now we've used this in practice. We've used specific essential oils in cancer patients. We've used frankincense, has been shown on its own to have an effect on cancer. So you can put in your essential oils in your bottom section where you got your aromatherapy section. You can put frankincense in there. You can put lavender in there. And we're using that combination in cancer patients because the lavender calms the person, has an anti-inflammatory effect, and it just boosts the effect of the frankincense. So what are the effects of the Hocatt in cancer? It decreases cancer pain. It decreases the side effects of chemo. This we've seen. We've seen patients coming through with cancer on chemotherapy. We put them into the Hocatt, and you'd see the towels turning black. It's taking out the chemo. It decreases the side effects of your chemo. Increases the energy. It removes the toxins. You have this effect of your pores opening up, the toxins with the heat coming in, the toxins starts coming out of those open pores. And it boosts the immune system and kills the infections, plus minimum. So Hocatt, even if you're not a practitioner, you've got somebody who's got cancer, you know somebody who's got cancer, or you want to assist somebody who's got cancer, put them into Hocatt, do a minimum of 10 sessions as a course of therapy, repeat that as many cycles as you can. We've got a clinical case, a 45-year-old female, cancer, multiple myeloma, taken chemotherapy, overweight, pain, fatigue, and this is what we put. We got her on a therapy program. We started off intravenous ozone. We gave her ear ozone, ozone sauna. What were we doing here? We were flooding her with ozone, whichever way we could. We just flooded her with ozone. We gave her intravenous vitamin C. We started her off on some herbal medications, cannabis, vitamin B17, and a few others. Started her off on a detoxification program of the colon, liver, and kidney cleanse. Started her off on PANAC therapy, which is another therapy, which is electrofrequencies, but you got that already in Hocatt. You got your right frequencies, so you can dial in. And what was the result? I just want to read this to you. On the phone. She sent me this, and I'd like to read this to you. I had stage 1 Hodgkin's lymphoma. I did chemo and radiation. At my follow-up scans, we found that there were multiple areas of concern. The report is attached. My oncologist and hematologist decided to wait and rescan. I heard of Dr. Moosa in PMB and I decided to try him in the time we had. We started ozone therapy intravenously and all the other forms of ozone given by Dr. Moosa along with the other therapies. After 6 months, we rescanned and I received a clear PET scan. Healing lies in God's hands, and this is our strong belief, but He will guide us to means and put healing into it. Apart from that, after using the ozone treatments, immediately I felt more energized. I could think clearly. It made me feel more positive. I also had dental issues that it helped me immensely. My skin also improved. I had a dull grayish look after chemotherapy and radiation. I continue with ozone therapy now as I feel a huge difference with it, both physically and emotionally. It has made a marked change in my life that was phenomenal. It helped recover. It helped me recover after my chemotherapy. It also helps me to cope with my three very active kids. So, ozone is a complementary therapy. It's an integrative therapy. You can use it in combination with any program, any treatment program. And you can see what has happened. Her markers went down, she was in remission, and she's on a maintenance program of ozone only.